provide us with a little bit of insight from the recent confirmed West Nile case in Midland County? What also is being, measures are being taken to address the concern?
So we conduct mosquito surveillance testing where we capture live mosquitoes and send them to the state lab for testing. That helps us identify earlier in the season if West Nile is circulating. We had our first detection in early May of this year. This was our first human case though, which was confirmed to us by the State Health Department. I think that's basically it with the human case.
Mm-hmm. And City of Midland sent out something about how, I guess, the mosquitoes contract this virus specifically, if you want to go into detail how that works.
Yeah, so what happens is mosquitoes will bite an infected bird, the bird that has West Nile virus. In the blood meal that they take, that virus is circulating, and so when they bite a human, the human then becomes infected with West Nile virus. We can't spread it human to human. A mosquito bites an infected person, they're not going to get enough of the virus in order to spread it to another person. And it doesn't spread via other means like, breathing, respiratory secretions, coughing, anything like that.
Right. And talking on this heavy rainfall, I think that's a big reason of why we all want this story out kind of today. Obviously, heavy rainfall yesterday and today. How does that contribute to an increase in mosquito populations alone? And then, again, the potential spread of diseases like the West Nile virus.
Yeah. So mosquitoes kind of like a few things. They like standing water in order to lay their eggs. The mosquitoes that people get bit by are female mosquitoes that are looking for a blood meal in order to nourish their eggs that they're then going to find a place to lay. And so standing water, they like standing water. With all of this rainfall, there's going to be a lot of that. So we definitely encourage people to dump any standing water around the home. It's a little cool today, but in the coming days, it'll get back up above 70 and into the 80s. Mosquitoes really like the temperature range about 80 to 90. And so as we get into that with standing water and with a higher humidity of the next few days, it's really going to be sort of prime habitat for the mosquitoes. And so we definitely want people to be aware of them and to take precautions like dumping water and wearing bug spray.
Yes, along with dumping water, bug spray, maybe long sleeves, maybe avoiding certain times that you go outside. If you want to talk more on other precautions people can take to kind of eliminate exposure.
Yeah, so long sleeve and pants, especially if it's going to be a little cooler, that's a little bit more doable here, not always, but we definitely encourage that. And then avoiding being outside at dawn and dusk. Those are when mosquitoes are really active. And also, if you're going to open your windows, make sure you have a screen on the windows or on your door, or run the air conditioning if you can. That also helps prevent mosquitoes from getting inside the home.
Are there specific, or you guys doing any research or initiatives kind of aimed at addressing mosquito-borne diseases? Or I know that you said you take these kind of studies each year, but is there anything else that you guys are doing?
Yeah, so our primary research into mosquitoes is definitely the surveillance, monitoring not just for West Nile, but a few other diseases as well, just to see what's circulating. Tell us also what kind of mosquitoes are circulating, and that kind of helps us be aware of the things to be on the lookout for. And then, of course, we send those mosquitoes to the State Health Department who tells us what they find in the mosquitoes. And we just, be aware about that. We send notifications like we did earlier this year when West Nile was first detected in the mosquitoes. And that's our primary form of mosquito surveillance.
Right. And then my final question, although they're kind of an insect that is kind of looked down upon, kind of has a bad reputation, they do have a part of the ecosystem. So I don't know, just talking on that, you guys don't have to use it, but just talking on that too, kind of, they still play a part in the ecosystem as a food source for, they play their part, although they can, carry disease.
Yeah, we definitely want people to treat, mosquitoes with a certain level of awareness and respect. We don't want people to be, overly fearful. Most people that contract West Nile will not actually have symptoms. They won't ever know that they had it. That's 80% of people who are infected don't have symptoms. And so it's not something to be overly worried about, not something to run screaming from every mosquito you see, but definitely take precautions, definitely, be aware of what mosquitoes can carry, and you want to prevent bites. No one likes to be, itchy all over because they went outside, and so preventing mosquito bites is kind of what we really want people to focus on.
I have a couple of questions if you don't mind. So first question I have for you, sir. Once a mosquito is infected with West Nile virus, we know it can't transmit it to other animals, but can it transmit the virus to other mosquitoes?
So it does not pass from the mother mosquito to the eggs that she lays after she's taken the blood meal. It can, other animals, like it can transmit, onto other birds. Some birds are more affected by West Nile than others. Birds of prey, ravens, crows will oftentimes die from infection, but other birds don't die as much. Other mammals can get West Nile virus as well. And so but it does not pass from the mother mosquito down to her eggs.
So, one step further on that, once another animal becomes infected with West Nile virus, it cannot be transmitted to a human.
Yeah, most mammals, I believe, the amount of the virus that circulates in them is not really enough for the mosquito to draw more of the virus out when it feeds on that animal again, or a different mosquito feeds on that animal. Like humans, we can get the infection, we can have the virus in us, but if a mosquito feeds on us, there's not enough virus in the blood for the mosquito to then transmit it later on.
So other tips, what are some other tips that you suggest for preventing the mosquito bites? You touched on the clothes, you touched on not going out at certain times. What are some other measures people can take?
The big one is bug spray. People, it stinks or it's just a hassle to put on, but bug spray really does work. We really want to encourage any exposed skin, especially to cover it with bug spray. If you're wearing, pretty thin long sleeve or pants, go ahead and spray those as well. You can also treat clothes with certain treatments that will help prevent mosquitoes if you're going to be really active outdoors. But bug spray is the big one that we want people to remember to use when they go outside.
And then for dumping water, when would you say are the best times of day to dump water? Is it better to do it at, say, 12 o'clock in the afternoon as opposed to 8 o'clock at night?
I think the best time would be, with the rain today and then chances of rain again tomorrow, once the rain stops, the best time to dump it is, as soon as you can, just because the longer it lingers, the more stagnant it gets, the more likely it is to attract the mosquitoes. For instance, for our mosquito traps, we use grass clippings that kind of sit out in the sun in water for about 5 days and gets really stinky, and that's what attracts the mosquitoes. And so if you leave the standing water, in 3, 5, 10 days, it's going to get increasingly stinky and attractive to the mosquitoes. So as soon as you can dump it is best.
Have there been any other cases recorded? I know that you said, it's just the one last week, but since then have there been any?
I think we're just reporting the one right now.
Is there likely to be an uptick?
So August and September are the sort of peak seasons for human cases of West Nile virus. And so, August obviously passed. We have a few more weeks left of September. And so this is the time of year we want people to be aware of it. It's because earlier in the summer, it's usually too hot for mosquitoes, at least here in Midland. And so this is the time of year when we see the most human cases.
And I know you guys kind of provided this information, but if people do show symptoms, and then 80%, 90% don't show symptoms, but when they do occur, what is it that people should be looking out for?
So it's like fever, body aches, joint pains, nausea, vomiting, diarrhea, which is not very specific. A lot of illnesses present with that. But if you have multiple mosquito exposures recently, and also if you develop those symptoms, we encourage anyone with those symptoms to go see a doctor, regardless of whether it ends up being West Nile or something else. Just because it's a good practice, they might be able to prescribe you either treatments or, in the case of West Nile, something to help deal with the symptoms.
Right, and there's no cure necessarily, but is there? How long does the virus stay in the body? Like, what does that look like in terms of?
So most people, the symptoms clear in a few days, but some can have it linger past a few days into a few weeks. Usually fatigue and weakness is kind of the persistent symptoms. In severe cases, of course, it'll linger for longer, but for most people it clears after a few days.
Question for you. Would you, on a 1 to 10 scale, 1 being very low, 10 being extremely high, what would you say is the threat level or worry level that residents in the basin should be worried about this?
I don't think it's extremely high. Last year we didn't have any human cases. Obviously we had the one this year so far. It's not something that everyone needs to panic about. It's just something to be aware of as something that you can take pretty easy precautions to prevent. It's like there's no cure or vaccine or anything like that, but simple bug spray will do a really good job of preventing it. And so we just want people to be aware of that, especially because in severe cases it can be pretty, people do die of West Nile, and so we want to prevent that, of course. And even, hospital stays, altered mental states, confusion, things like that can appear from severe cases. And so anything we can do to avoid that is kind of really what we want.
Sorry, last question. I think there was also mentioned to be a certain age group that should probably be a little bit more weary. If you can just talk about that.
Yeah, so if you have any serious health conditions or are older, 50 or older, you definitely need to be more aware about it, and definitely take those precautions that we've mentioned, just because you are at higher risk for more severe manifestations of it.
That's all.
That's all
Anything
from
else you'd like
me.
to add?
No, just with all the rain, we definitely recommend that people take the opportunity once the rain stops to dump the standing water, especially since it won't be too hot outside yet. And so, yeah, get out there, dump the water, and don't let mosquitoes get a chance to bite you.